Eh, it is a day, and here is a dog. So there's two articles been going around, and these articles have caused a bit of worry among certain groups of manual therapists. And one of them is called Comparing Targeted Thrust Manipulation with General Thrust Manipulation in Patients with Low Back Pain. A general approach is as effective as a specific one, a randomized controlled trial by Christopher J. McCarthy, Louise Potter, and Jackie A. Olden. There's another one here. Immediate effects of region-specific and non-region-specific spinal manipulative therapy in patients with chronic low back pain, a randomized controlled trial. I'm not going to try and say the names. Please read them. They did a lot of work, a lot of good work to this, but I don't want to butcher them. So, here we are. Anyways, people in the manual therapy world are having a bit of trouble with these articles. And I would say, I think it's mainly the chiropractors that are having this issue. And there are a few physios too who emphasize the manipulation method, I'm sure, that are having some of the same issues. The massage therapists are more than likely too chilled out to care, as per usual. But despite being well written and conducted, and these articles are, with very reasonable conclusions, I'd like to think there's some definite positives to these articles that the manual therapy world probably isn't emphasizing as good it could be, or they're not reading the article as effectively as they could. And I think as well there could be some alternate meanings we could look to, more than what the articles went into. The studies found that, and I'll just say I'm generalizing here. Studies found that one, spinal manipulation generally applied is just as effective as when it is specifically applied. So, as in targeting a specific spinal segment. With HVLA or thrust or HVT, it relieves pain just as much as when the practitioner does it to a single isolated area. General is just as good as specific. That's the point. Second point, again, a generalization, but applying spinal manipulation to a painless area that's above or below a painful area reduces pain. So, for instance, applying a spinal manipulation to the thorax could reduce pain in the neck or lumbar spine, and was shown to in the case of the second study. And there, of course, was far more than that in these studies. There's lots more, and there's methods and ways in which they conducted this. But these were the main points of concern that I found. And just to clarify, just one more thing. To clarify, these studies were specifically done on spinal manipulation or HVLA, high velocity, low amplitude thrust, or HVT, as they tend to call it in other places, high velocity thrust, or just thrust in general. Usually we associate it with a rapid mobilization with a popping sound. A lot of layman's term, it's cracking the back. It's not a great name for it, but you know what I mean. Anyways, and these were also associated or specifically relevant to pain reduction, just to be clear. So the authors, they write this, and they make the statement that spinal manipulation, because of this, spinal manipulation might not need the precision by the practitioner as previously thought. Because regardless of where it's applied or how specifically it's applied, it has a pain-reducing effect. Some people didn't like that, but I gotta say, first of all, that's awesome news. That's really fantastic. A definitive statement of manipulation in pain control. It's not exactly what you want, but it's a very good thing. It's clear evidence of that pain control. Part of the issue lies with manual therapists who focus on specific HVLA or thrust, is that it doesn't create lasting structural changes that they once thought occurred. I gotta say though, this is pretty fair, and I'll agree that thrust, HVLA, you probably shouldn't see immediate structural changes, especially with the singular manipulation. It doesn't make a lot of sense. The authors go on to say that this will mean reduced time in training of new practitioners because of this information. Because teaching general adjustment by thrust is faster as opposed to intersegmental concepts and specific targeting of a spinal segment or like a really specific joint or region or a tissue. And if taken as true, this is very good. It's a very good statement, a very good idea potentially. If you can cut down on training time for students both they and their instructors will be thankful. And it probably saves money for the educational institution as well. They won't pass any of that money on to the students, of course. In fact, they'll just charge more, calling it, like research or advancement in training. That's the way of the world. On this reduced training or non-specialization, the social media has taken this point perhaps too far. Almost saying that spinal manipulation, because of this information, almost saying that spinal manipulation is random and requires no intelligence, or like less intelligence, I suppose, to perform. This was not the tone of the articles. If you read them in full, and you should, they're very good articles. If you read them in full, this is not necessarily what they're trying to say. You could argue that the specificity of identifying an area of adjustment, an intersegmental area, is not needed in training. Though I feel that taking this too far, I feel that it can be unnecessarily self-limiting. Conceptually, it could prevent further research or application. Just saying this is as far as it goes, it's just a blunt adjustment, unpointed. It gets the job done. It's like pushing a button. It's going to have one specific effect, and only one specific effect. That limits progress in some cases. It doesn't mean that the manipulation applied cannot have a more beneficial effect if some of the elements are changed. For instance, just real simple, elements such as the regions you apply the adjustment to, how many areas worked on, for instance, how many areas are going to work on in the treatment process, the sequence of that application too, when those areas are worked on and in what order, top to bottom, left to right, these simple adjustments, the intensity with which the adjustment is done, the frequency with which the adjustment is done. These things may change the results. And the studies were done with a single manipulation applied to a single area. And this was the right thing to do for those studies because that's what they were looking at. There's absolutely nothing wrong with that. But to say that it only is so effective doesn't actually make a lot of sense. We have to ask, is there a compounding or synergistic effect with multiple manipulations being done, or the timing of the regions? I think this is worth looking into, at least because of what we're starting to understand about chronic pain and the irritation that comes at a low level from tissues and results in much bigger effects over time. But I'm actually going to take this in a different direction. I'm going to suggest that there could instead prove this, both these studies taken together, could prove one of the major concepts of an integrated body or an integrated model or whatever you'd like to call that, as it applies to structural therapy and the tensegrity concept. I think one concept that people are somewhat familiar with widely, tensegrity, but a global approach, we could say, just a full body approach. Firstly, in an integrated mechanoneural tensegrity model, which that sounds really fancy, but it's just a word salad I threw together, within those concepts, pain is not really the indicator of the problem most of the time. Pain's important, don't get me wrong, but it's part of the body. It's part of the process, but it's not the entire thing. And really, the pain is almost a misdirection in many cases and should not be the sole target of treatment. You don't just rub the painful area, you figure out what the body is doing as a whole. If you're of the opinion that all manual therapists believe that the painful area, the painful segment, for instance, that's the cause of its own pain, it's both cause and effect, in fact, its own little pain microcosm, this is really not the basis for all manual therapy practices. For some, sure, but not all. Just to get the idea of this concept, though, to get it through, the big picture of all this, we would say one area is reactive and influenced by all other areas, mechanically and transferring weight around neurologically by automatic balancing of that weight. We could go into blood flow, fluid flow, and hormones too, but let's not go crazy here. Simple examples. But that's an amount, understand that's an amount of variables too massive for anyone to truly understand. So more specifically, let's just look at those studies and what they showed. Again, just to reiterate, one study said that generally treating an area versus aiming for a specific segment gets the same effect. So you apply adjustment, let's say, generally to the lumbar spine, longitudinally along the lumbar spine is the Same pain relief as in a specifically identified and targeted segment. But the integrated view or model would say that it's impossible to separate the segment from what is holding it. And what's holding it is actually pretty wide reaching. For instance, there's a vertebra or any bone, but let's say there's a vertebra, and all around it is a network of tendons, muscle, ligament, fascias, nerves, arteries, veins, lymphatics, and organs do attach to some bones through their connective tissues. And those all have their own attachments themselves. They extend outward from that. Can you really expect to move or affect one without affecting the others? It seems very unlikely. The issue with specifically segmented targeting HVLA process or like cracking a spot, layman's terms, when it comes to movement, is that it is actually a pretty small region affected if you're just going after the one spot. The bones, the joint capsule, close small ligaments, muscles, these are important, but they're part of larger configurations of muscles that likely would not be impacted significantly. So really, to get it all, you have to get it all. Weird way of saying it, but it's mostly true. If the maneuver at a minimum can create beneficial pain control, it would likely be best to affect as many things as possible. So it's not a bad thing. Working generally in a region actually should make more sense. And in fact, it should make a bigger difference. There are probably exceptions to this, but it makes sense in an integrated perspective to operate in this way. By no means is this a negative in the manual therapy world. It might require change in thought and change in applications, but it's more than likely for the better. In the other article, its main point said that you can treat one region to reduce the pain in another. So a painless region is adjusted, spinal manipulation we're talking about, and another more painful area gets better because of it. Now, what was of interest was that there was no explanation given as to why this worked. And this is likely just because the authors weren't sure, and that's perfectly reasonable thing to do. If you don't know, you probably shouldn't say it. I probably shouldn't be speaking right now in general. But anyways, it's just a YouTube page. It probably needs, several more studies to really figure this out, to understand why this might be the case for academic rigors and something that should be done. And it'll give us something to argue about quite consistently over the next few decades. I'll be there. But taking the pain as its own isolated cause and effect model, that indeed is an unexpected result. It doesn't fit with that model. But it fits perfectly, and in a very obvious way, into an integrated model. I'm going to go back to that in a second, though. When you're looking at a result that is unexpected and not fully understood, I don't think that concluding it was an irrelevant effect or an arbitrary or a kind of like a nonsense effect is the right choice. Again, this is not what the articles say, but it seems to be coming through on the social media end. Until you better understand why the effect has occurred, you really can't understand its full potential of effects. I believe this was the case in the study where the thoracic spine was adjusted and creates pain relief for the cervical spine. But to do this in a better or more comprehensive way, not better, the article was great, there's nothing wrong with the way it was conducted, but to do it in a more complete and comprehensive way, you have to ask, how far can this relationship go? We want to understand, is it just thoracic spine to cervical or lumbar, or can we adjust the lumbar spine and see a change in the cervical spine? That's the neck, by the way. Can we go from the knee to the thorax? Can we go from the ankle to the AA joint? Pretty far away from each other. Does that still work? If it does, that's amazing. That's a fantastic result, and it implies a bigger relationship. From a movement perspective, there's a very simple answer, almost too simple, and I don't mind criticism on this point, but any area, really, really easy, will have long muscular overlaps between multiple areas. Basically, it's just that long muscles tend to cross long regions of the body. In fact, this is especially easy to see in the neck and the thorax, where some of the neck muscles start in like the mid upper, even like you say the low thorax. So you can see it quite easily in the trapezius and the longissimus fibers, for instance. And there's a ton of fascia bridging the body too, arguably bridging all of the body. That some would argue is even more important, but most people know muscles better, so I'm just going to leave it at that. So muscles, long relationships, fascia, there too, also really important. The one area, it just has to depend on the others. You can't move the head or neck without pulling on your thoracic region. You can't move your thorax without pulling on your lumbars, and it goes further up or further down depending on which direction you're moving and how you're moving. Would it not be much a worse idea if these regions worked in a completely isolated way? Wouldn't that be a huge waste of potential if they didn't share the load, or if they didn't communicate with each other through reflex and through sensation? If they are an integrated unit, they should change pain sensation each other. They should. That's what makes more sense than less sense. I'm of the opinion that anything that can be done better. And this might take extra time and research as well as training. And you probably have to fail a bunch to really get there in a good way. But if it's a chance to help someone, it's worth doing. That's it.